Tetanus,
or commonly said as lockjaw.
What causes tetanus? Tetanus is caused by Clostridium tetani bacterium. Clostridium tetani spores are able to survive for a long time outside the body. They're most commonly found in animal manure and contaminated soil, but may exist virtually anywhere. Common ways of contracting tetanus: wounds that have been contaminated with saliva or feces, burns, crush injuries, wounds that include necrotic tissue, and puncture wounds. What happens when Clostridium tetani bacterium enter the body? When Clostridium tetani enter the body, they multiply rapidly and release tetanospasm, a neurotoxin. When tetanospasmin enters the bloodstream, it rapidly spreads around the body, causing tetanus symptoms. Tetanospasm interferes with the signals traveling from the brain to the nerves in the spinal cord and then onto the muscles, causing muscle spasms and stiffness. Puncture wounds. Clostridium tetani enter the body mainly through skin lesions. Thoroughly cleaning any cut helps prevent an infection from happening. Symptoms of tetanus. Tetanus symptoms usually emerge about 7 to 10 days after initial infection. However, this can vary from 4 days to about 3 weeks, and in some cases it may take months. In general, the further the injury site is from the central nervous system, the longer the incubation period. Patients with shorter incubation times tend to have more severe symptoms. Muscle symptoms. Spasm and muscular rigidity, muscle becoming stiff. Stiffness usually starts with the chewing muscles, hence the name lockjaw. Muscle spasms then spread to the neck and throat, causing dysphagia. Patients often go to have spasms in their facial muscles. Breathing difficulties may result from neck and chest muscle stiffness. With some patients, abdominal and limb muscles are also affected. In severe cases, the spine will arc backward as the back muscles are affected. This is more common when children are affected.
more symptoms. Most patients with tetanus will also have the following symptoms: bloody stools, also known as feces, diarrhea, fever, headache, sensitivity to touch, sore throat, sweating, and tachycardia, also known as rapid heartbeat.
Complications. Symptoms may include fractures. Sometimes in severe cases, the muscle spasms and convulsions may lead to bone fractures, aspiration, pneumonia. If secretions or contents of the stomach are inhaled, a lower respiratory tract infection can develop, leading to pneumonia. Laryngospasm. The larynx goes into a spasm which can last up to a minute and cause breathing difficulties. In severe cases, the patient can suffocate. Tetanic seizures. If infection spreads to the brain, the patient can have epidemic like fits or seizures. Pulmonary embolism. A blood vessel in the lung can become blocked and affect breathing and circulation. The patient will urgently need oxygen therapy and anti-clotting medication. Or severe kidney failure, acute renal failure. Severe muscle spasms can result in the destruction of skeletal muscles, which can cause myoglobin, a muscle protein, to leak into the urine. This can cause acute renal failure or severe kidney failure. History of tetanus. Tetanus was first recognized by Arthur Nicollier in 1884. It was considered a threatening and unique disease in the mid-1800s when there was about 205 cases of tetanus per 100,000 people. The source of this infection was quickly recognized, and precautions were then taken to ensure this number of infections does not increase. In the early 1900s, there was an average of only 16 cases of tetanus per 100,000 people. This was a significant decrease since the disease was first formally recognized. Today, the disease is almost completely diminished in the first world countries. In 1998, only 35 people were diagnosed with tetanus in the entire country of the United States. With the aid of booster shots, awareness, and safety precautions, tetanus is no longer a large threat as it was 150 years ago.
Tetanus vaccines. The tetanus vaccine is routinely given to children as part of the DTaP shot. The DTaP vaccine consists of 5 shots, usually given in the arm or thigh of children when they are aged 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. A booster is only given to children between the ages of 11 and 18 years, and then another booster every 10 years.